brief case. Titled it Right Parasymphysis and Left Angle Fracture. So why would I go ahead and give you the diagnosis in the first slide? That's because I'm trying to make a point. It's really not about the diagnosis here. I'm trying to emphasize the point in mandibular fracture reduction that occlusal reduction is more important than anatomic reduction, and you'll see what I mean in just a moment. Here's a patient who presented with jaw pain and malocclusion post-trauma. I hope you can see that there's an occlusal step-off right here. And there's a gap between these two teeth right here. And this is pretty indicative of a fracture. This is the patient's panoramic radiograph. And again, you can see there's a right parasymphysis fracture right there. You can see there's a step-off at the inferior border. And there's also the occlusal step-off that we saw in the intraoral photograph. There is also a left mandibular angle fracture right here. And a couple things I want to point out is that it goes through the socket of the third molar. And you can also see, let me trace this out for you. Here is the inferior alveolar canal in the distal fragment, and here it is in the proximal fragment. So there is a little bit of discontinuity there. And I'm sure the patient does have paresthesia, but surprisingly this is not much of a concern in the long run. This intraoral photograph demonstrates improved occlusion, status post, closed reduction, and maxillomandibular wire fixation. Here's the patient's post-reduction panoramic radiograph. You can see there is improved alignment at the inferior border here, but there's still a step off here, and there's still some discontinuity of the inferior alveolar nerve canal there. But again, that's not really a big deal. This again emphasizes the point that occlusal reduction is more important. So as long as the teeth are in the right position, the patient will have a good bite. However, this wants to heal, let's say with callus formation and new bone formation, as long as the condyle is in the fossa bilaterally and the teeth are in correct occlusion, then the fracture can heal however it wants. And as long as it heals without a malunion or non-union, the patient will have a normal occlusion and normal function. And there won't be an aesthetic deficit from this at all. In addition, the infraorbital nerve heals very well, even with slight discrepancies within the canal. And it's thought to be due to the fact that the bony canal provides some sort of conduit for healing. And this is as opposed to lingual nerve injuries where the nerve's just flopping around in the soft tissues and normal healing without intervention doesn't often take place.